So we're going into our first panel discussion for today. It's on childhood obesity and NCDs, non-communicable diseases, in the region, as well as an introduction to our healthy food policy. And to moderate that panel is none other than Charity Dublin. She is a nutritionist as well as a healthy Caribbean youth member from Antigua and Barbuda. Where are my Antigua and Barbuda people to really shout out Charity right now? Please show support in the chat for Charity Dublin. Charity, the floor is yours.
Thank you, Christina. Good morning, everyone. As Christina would have mentioned, my name is Charity Dublin. I am a public health nutritionist from Antigua and Barbuda and a proud member of the Healthy Caribbean Youth. I'm absolutely thrilled to be moderating this panel, and we have some fantastic panelists where we'll be discussing childhood obesity and NCDs within the region, and also looking at an introduction to healthy food policy. So if we were to have a look around us, we'd notice certain things. So the Caribbean diet, very similar to other small island developing states, has changed a lot over the last couple of years. If we think back to, we're all young people here, most of us are young people, but if we think back to even the types of foods that we used to eat when we were younger, we would see that there is some sort of transformation, some sort of transition that has taken place. So our diets are more so being influenced by other global countries, and what we're seeing is affordable and heavily marketed foods that are processed, and especially those that are ultra processed, meaning that they are very high in sugars, sodium, fat, saturated fats, trans fats, these nutrients of concern. And what we see is that a lot of these foods are imported. So if your country is like mine, Antigua and Barbuda, we import most of our food. Almost all Caribbean countries import over 60% of their food, and 50% of the islands import over 80%. And what we've noticed, we're coming out of the COVID-19 pandemic. However, this has also threatened food and nutrition security within our region. And the nutrition transition is increasing the availability of unhealthy foods, which are high in these nutrients of concern. This has been increased by the pandemic. And what is happening is we're having a worsening of overweight, obesity, and non-communicable diseases that are facing the Caribbean. So we're seeing a rise in childhood obesity. And the prevalence of obesity in Caribbean children is 2 to 3 times higher than the global average. What we really, really need is policies that provide a solution for a healthier Caribbean, policies that can help to curb the crisis that we are facing, policies that can help to protect our future, which is the youth. We are encouraging persons to ask questions in the chat, and we're going to try to address them during the discussion. I am now going to be turning the floor over to our panelists, which I will introduce now. So we have Alex Johnson, who is a nutritionist and a Jamaica Health Advocate Youth Arm member and also a member of UTENS. We have Lisa Schaaf, who is a 4th-year medical student at UWI Mona, and also a Jamaica Health Advocacy Youth Arm member. We have Stacia Whittaker, who is a nutritionist and a member of the Barbados Childhood Obesity Prevention Coalition. And finally, we have Andicia Tuitt, who is a young person living with an NCD and also a member of the Healthy Caribbean Youth. So we're gonna jump right into what I hope will be a very fruitful discussion. So we're going to be turning it over to Alex now. Alex, how serious would you say the obesity and NCD epidemic is in the Caribbean? And in addition to that, what do you think are some of the causes? What are some of the things that are driving this epidemic?
Good morning, everyone. Good morning to our moderator and my fellow panelists. It's a pleasure sharing with you all this morning in our Healthy Caribbean Coalition food policy seminar today. And I just want to give a short overview of the whole NCD crisis. I'm speaking specifically to Jamaica, but I know that some of this data is international, it is regional, and we're seeing in other Caribbean countries where NCDs, and for the note, NCDs mean non-communicable diseases. So non-communicable diseases are those diseases that are not transferable by contact, but rather developed through family genetics, degenerative changes, or unhealthy lifestyle habits. So non-communicable diseases and injuries are a major part of the public health burden in Jamaica. So this is what is eating out majority of our country's money and budget in health care. So this is an area that we also want to push to show them that if we put in these policies, we can lower the amount of money that we are spending in the healthcare settings. So just some quick statistics. In 2015, an estimated 7 out of 10 Jamaicans died from the 4 major NCDs: cancer, cardiovascular diseases, diabetes, and chronic lower respiratory disease. Many of these deaths are lifelong disability and compromised quality of life could have been prevented. So we see where all of these conditions could have been prevented. A cost of care analysis done in 2017 by the Violence Prevention Alliance and the University of the West Indies Hospital and other stakeholders show that the financial cost of injuries to the healthcare system to be Jamaican $12.6 billion per year. So we are seeing where NCDs is severely costing our healthcare system. I now hand over to our moderator, Ms. Dublin.
Thank you, Alex. Absolutely fantastic points there. So we see that NCDs are a really big problem that are affecting our population, resulting in not only death, but also disability. And they're affecting not only individuals, but also our economies. I'm happy that you spoke about the disability aspect of living with NCDs, because persons will always say, something has to kill me. So if I'm going to die, I'm going to die. But it's not just you dying. It's the fact that it's the way you die. It's the fact that there are all of these steps that are debilitating and that are leading to that. And not only are you dying, not only are you could you develop disabilities, but you're also placing a burden on your families, societies, the economy. So we really want to have a good grasp on NCDs and on getting them under control. Next, we're going to be moving over to Lisa. Lisa, what is your perspective when it comes to Jamaica and the patients living with obesity and NCDs as a medical student?
Okay, well, I want to say good morning to everyone. I'm happy that you all have, taken the initiative to join and to hear about, what we want to talk about today. So basically what I brought to the table today was that I want to talk more about my experience at the hospital and seeing the patients with these NCDs normally at the very end, or the terminal, or the end where it's very bad. And as Alex said about disabilities, like that is not really talked about enough, because when you have these diseases and you don't, take your medication and you don't do your test and you don't control it, your system is a full circle. If one thing is not working, it starts to add pressure to the other systems, and then they break down as well. For example, in diabetes, it's very common to have amputations for diabetics due to the fact that, with diabetes, it can damage your nerves and you're unable to realize injury. Like, for example, if you step on a pin and you have injury, when you're diabetic, you tend not to feel or realize that you actually stepped on something and you have a cut. And then on top of that, you don't heal like the normal person. And so they tend to get gangrene. And when it gets gangrenous, we have to amputate. And when they have these wounds and stuff like that, they don't have the money most times. Like I have this patient, I'm going to call her AS. She was a 55-year-old lady and she was a shopkeeper. This was at KPH. And she was from St. Catherine, Portmore. And she didn't have the money to buy the dressing, the antibiotic dressing, because she wasn't working. She was at the hospital. She doesn't work, she doesn't eat, she has no money. and we had to end up putting money together to be able to afford the medication for her, you know. And she said to me, you know, doc, I wish that I was able to know this when I was younger, that, you know, I shouldn't have the sweet drinks and the sweets and the putting all, you know, the Kool-Aid and putting this whole heap of sugar in there, and, you know, having the donuts and the cupcakes at the school gates and stuff like that. You know, when she used to come home, she'd always have a Sky Juice and stuff like that. You know, she really wished that she was taught about this. It's, you know, she's learning about it now, but it's already at the end where can't be reversed, you know. And that's just the case for diabetes. We have hypertension. We see that almost every other patient has either diabetes or hypertension at the hospital. And I see that with them. I had a patient called him BJ, and he was 42 years old, and he was a taxi man, and he had hypertension. He said, men, you know how they are sometimes. They wait till they're dying or almost dead before they show up at the hospital. And he wasn't taking his medication. He said, doc, I don't have the money for that. I have to buy parts for the car. I have to buy gas. I need to be able to run my taxi. And it ended up that the hypertension being uncontrolled damaged his kidneys. And he ended up with end-stage kidney disease. And now he has to be on dialysis for the rest of his life. You know, so the lady previously AS, she's now, you know, she has no limbs, so it's harder for her to, you know, do her daily activities as a shopkeeper. And now we have BJ, who he's now on dialysis. He'll have to take off time twice a week, you know, coming to dialysis, sitting down for 4 hours each session, can't be doing your daily activities, and your income is affected. And these things are expensive, you know, medication is expensive, these treatments are expensive, and so it's better to prevent than to cure. That's what we're always trying to, you know, push. That people think that doctors think they make money off of you coming to us to cure you and stuff like that, but it's actually the other way around. We want you to prevent coming to us. I know it sounds odd, but we really do want to have these, you know, patients be educated from day one. You know, that's how we try to, you know, the youth is who we really push the information to, because the thing is that society repeats itself. You grow up, you see your siblings eating these certain foods, your parents are cooking this to give you, you need to speak up and say, mommy, I think we need to have less salt in our diet, less sauces, less Maggi seasoning and those powder seasonings, let's use some natural stuff. Or, you know, all right, mom, I'm gonna bring a water bottle to school, so I will stop buying all the juice at lunchtime, or I would have the water, I wouldn't need the bag juice at the school gate and stuff like that. So it's really important that, you know, we are doing this and trying to get the youth from as young as possible, so they can spread their wings and, you know, tell their siblings and their friends and families that, you know, this needs to change. So yes.
Thank you, Lisa. Absolutely fantastic. And what I really loved is the way that you pulled out the importance for prevention, not only for primary prevention, meaning that we want to prevent the development of the NCDs, but for persons who are living with these conditions, that they are able to prevent the development of complications. That really is so important. And also the role that we as youth have when it comes to influencing not only our peers, but also our parents and our family members. So thank you so much for that, Lisa. We are moving on to Stacia. Stacia, we know that prevention and management of NCDs requires a comprehensive approach, and that a comprehensive suite of policies is also needed and has proven to be absolutely critical. Please tell us some more about the policies that our country should prioritize.
Hi, thank you so much for having me this morning. I am going to do that by just sharing my screen and doing a quick PowerPoint. I'm such a visual person, so forgive me, but I'm enjoying all this information that has gone before. So to best answer that question, we're gonna have to probably go back and really look at things. Let's keep it real. I like to say, we're now dealing with COVID, not to bring up the topic because I feel like I've been overrun by that topic. But when we look at the comparison of what is happening within our region, within the world, but specifically within our region, we are looking to see that non-communicable diseases, and this is coming from the World Health Organization data, over 41 million people each year compared to up to yesterday, the total deaths coming from COVID We're also seeing that each year more than 15 million people are dying from NCDs. Now, if that doesn't get you a bit kind of frustrated, most of the largest contribution of these deaths, mortality and morbidity, is happening within low to middle income. And we know Alex kind of touched on this. And we could imagine, and we can agree, that the Caribbean is considered low to middle income type of area. And is even worsening to say that the disability is expected to worsen by 2030. And I don't think a lot of this took in consideration COVID and all that would have happened in COVID and all the changes and lack of physical activity and everything that has happened. But worse yet is that when we compare ourselves to the global society, the Caribbean is out front in, unfortunately, NCDs, whether it's cardiovascular disease or whether it's diabetes or kidney disease, as the last speaker just talked about. And I love that she made it real and talked about her experiences. So I always like to say the more things change, the more things need to change. And that is because we need to put policy. Policy is important when we compare what other countries are doing. They have the same sweetened drinks. They have the same ridiculous environment when it comes to fast food and over processed and ultra processed type of foods. But what are they doing that we probably need to get on board and vigorously do? We know the statistics are out there. 1 in 3 children, and a lot of this was done before COVID. Anecdotally, I feel it probably is worsened by now because kids were less active, they stayed indoors more and things like that, not to kind of be the voice of doom. But I'm saying all of this to say that the area of policy needs to be hard hitting, it needs to be forceful, it needs to be relentless. We need to demand healthy school policies, and where I'm happy that across the region, a lot of this have been drafted, a lot of this is being implemented and soon to be implemented. Taxation on sweetened drinks, we're seeing that that is also occurring across various regions. So that is awesome. We're looking at really attacking the marketing towards children for unhealthy sweetened beverages and foods. We really want to get that on board. But I'm always want to say policies are really good, but we got to implement. We got to have the programs. We got to have the monitoring and evaluation so that we can fill the gaps and bridge the gaps where the gaps, because there will be gaps. It's not going to be, all right, we have a policy, toss our hands off and all is done. It's going to be ongoing. It's going to be a living policy if we really want to tackle, rustle, tie up, and get rid. And I'll say get rid because I believe we can work towards having a region that is not considered one that is high on the list of highest amputee, on the list of cardiovascular health. We're even known to be the biggest consumers of sugar sweetened beverages. Can you imagine that? So we need to not only approach our challenge from a policy, but after the policy, we got to keep going at it, programs, etc. So a broader approach is that we want to see school-based nutrition education. We want to get our children educated, and I like to add empowered, because I believe education only takes us this far. Once we empower, persons can make the best choices no matter what, even if you put them in an environment that is a bit different. They're empowered still to seek out and make those changes. We want to increase access to healthy foods, so we're looking at our environment again. We're looking at policies that will speak to that. We want to create supportive environment at schools. Hence, we talk about the school nutrition policies. We want to talk about home as well as within the community. So we've been talking about the front of package warning labels so persons can choose healthy foods, take it to their homes, feed their children, and this then can continue to mushroom into individuals and children making healthy food choices. So we want to monitor and we want to be banning the sale as well as the taxation of sweetened beverages. And I think we're getting there. I think we're doing an awesome job. I know we're doing a great job. My thing is that we just got to keep going at it. And therefore, these policies as it relates to NCDs and childhood obesity needs to be ongoing. And having you guys as advocates, I believe we can really, really make a difference. So like I always say, the more things change, the more things needs to change. Now let's be that change. Thank you.
Thank you so much. Really, the need for living policies that are not only implemented, but regularly monitored and evaluated. And of course, these policies being school-based nutrition policies, policies that support access to supportive environments and to healthy foods as well. And we are moving quickly along to Andesia. Andesia, we just heard from Stacey about the importance of policy for the prevention and the management of NCDs. But tell us, why is it important to integrate persons living with NCDs and young people in advocacy work?
So good morning, everyone. I hope everyone is doing well today. First, I would like to thank everyone for the opportunity to speak today on the importance of involving people, especially young people living with NCDs in policymaking and programs. Now, if we think about it carefully, we will see that persons living with NCDs are the key to get into the public. What do I mean by this? So we are the ones who are living through it. We've seen the ups and downs, we've faced the challenges, and we know the best ways to reach out to the public. Now, if I say, hey, this is what I'm going through, these are the medications I have to take, this is what I have to do on a daily basis, these are the diets that I have to eat every day. By doing this way, we get to people so that they can think for themselves, hey, this is what I got to do to avoid having to do this every day like she does. And it also opens a doorway. Should I say doorway? I should say doorway. It opens a doorway for other persons who are also living with diabetes or, other non-communicable diseases to come forward, say, hey, I am a person, for example, let's say I'm a person living with complications. And if I knew what I knew right now, I would not be living with these complications. And it is important that we educate the public on it is important that we educate the public on the different ways to prevent complications. And you by using people with NCDs, we're able to get to the public because we have personal experience. So it breaks the stigma around NCDs because a lot of persons do not like talking about NCDs. For example, when I first got diagnosed with diabetes, I did not want to go on the radio. I did not want to talk. I didn't want to go onto TV because there's a stigma around having an NCD. Hey, it's a death sentence, apparently. So it breaks the stigma seeing other people out here advocating as well as I am. We feel included. So it is important that we have persons living with NCDs to also come forward and advocate as well. So as I said, we're the ones who know what we feel. We speak from experience. And if we're able to, advocate, especially the young people, because it's important that young people, because we know the best ways to reach out. Trust me, with all these social media, we are the best people to reach out to the public. So it is very important that you use young people young people in policy making and these different programs. As I said, it's just the best way. It's the most effective way, and it's really important. So I pass it back over to you, Charity. Thank you.
Thank you, Andesia. Absolutely fantastic. Really encouraging us to use the voices of persons who are living with these NCDs as educators. So that wraps up our panel. Absolutely fantastic panelists. Thank you so much to Alex, Stacia, Lisa, and Decia. You really summarized the points, created a fantastic introduction, because we know that NCDs are a serious problem that are affecting our population, resulting in not only deaths, but disabilities, and affecting not only individuals, but also economies. So really, we need prevention and control that protect the quality of life and livelihoods as well. And of course, we're seeing here that youth are able to influence both their peers and also their parents. And of course, Stacey would have driven home the need for living policies, and of course, the need for us to use persons living with NCDs as educators. So we need all actors on board. We need individuals, communities, healthcare providers, policymakers, and of course, us, the youth, because we have the power to demand a change that is required to protect us and to protect our future. Back over to you, Christina.
Thank you so much for that session, guys. So Charity and Decia, Lisa, Alex, all of you, provided some impactful information, and Charity summed it up well. So I don't think I have to go in depth on, all the information that was discussed. But I mean, just to recap, we've learned so far that over 70% of the expenses attributed to the costs associated with NCDs, especially in Jamaica, is projected to be, some billions of dollars. And we find that there are lots of prepackaged, ultra processed foods and sugar sweetened beverages that are available across the Caribbean region, and they're pervasively marketed, and most of which are imported, and they are, they contain egregious amounts of nutrients of concern. So the saturated fats, the trans fats, added sugars and sodium or salt. And we see that NCDs, they are rampant across the region, right? And they severely cost our healthcare systems. And we've seen that from Stacey's presentation, NCDs kill up to 41 million persons annually. And we've also heard of, the detrimental impacts of these NCDs, right? How they impact our health, and simultaneously the burden on, healthcare systems across the region. So it's best to work on preventative measures rather than, waiting until they're at a clinical stage where you have to report to the emergency room or medical facility to spend, and it's going to cost us as citizens, right, when it gets to that stage, as well as costing our governments to treat, procure medication, any equipment that is needed to help deal with these issues, right? So that's some of the main points we gathered.